This is Jamie Diaz with Barks to Basics. I am here today with a very special guest that I also like to call my friend, Dr. Lisa Radosta. Hi, Lisa.
Hi, Jamie. We've been friends for pretty close to 20 years.
It's kind of crazy,
It's
right?
insane.
It's
Yeah.
insane.
Because I don't feel old, but yet here we are.
You don't look old
Thank
either,
you.
as I have my readers on. So Dr. Lisa Radosta is a veterinarian behaviorist. So what does this even mean? Like, I wanted to go through, I don't think a lot of people, especially in the dog world, the dog clients, I don't think they know. They go to their veterinarian and then they hear, oh, maybe you should go to a behaviorist. And are you both? Are you one? I know the letters that you have after your name and I know people see them, but I honestly don't think they know like what an elite kind of person you are in this position. So what does that mean? What kind of schooling did you have to go to and what do the letters stand for after your name?
Right. So the letters are DACVB. It means that you are a boarded veterinary behaviorist. So you're a veterinarian, then you do some sort of internship. That's a year. Then you go and do a residency. That's between 2 and 5 years. Mine was 3 years. I did mine at University of Pennsylvania. Then you credential, you publish a paper, yada, yada, you pass the exam, and there you are. So really what we are veterinary psychiatrists. So pets that would come to us, dogs, cats, I've seen raccoons, lynx, Triton cockatoos, everything, right? Mm-hmm. They come to us when they have a serious behavior problem. And what is serious depends on the pet parent. Mm-hmm. Some of us can live with things that are really egregious to other people and think they are completely normal. Like my friend has 4 border collies. They are well trained. And I went to her house for dinner, and I was wearing these beautiful red suede boots. You know I like my shoes. Mm-hmm. Those dogs jumped all over me, really well trained, like agility and herding dogs. Well, the boots were ruined, and I was so irritated. But to her, that behavior is perfectly acceptable. So what's serious depends on the person that lives with the pet.
Yeah, and I think I've had some clients that are puppies and, you know, they're aggressive puppies and normal things, and they'd be like, oh, I went to see, you know, the behaviorist, which was you. And I'm like, oh, okay. And it was normal things. And even in your report, it was like normal things. So I think it's true. Like for them, it was like aggressive behavior and it was too much for them. And for other people, they will live with just whatever. And we are going to get into exactly the behaviors too. But I just want to say, because this happens a lot, I know you're not online a lot, but I am, unfortunately. Always posting and stuff like that and seeing what's out there. And I even Googled, you know, behaviorists in the area. I think even my company came up at top and it doesn't say anything, you know, in there that I'm a behaviorist, anything like that. I am not a behaviorist. I think I'm a skilled dog trainer and I try to like continue my education, but I didn't do a residency. I don't have those credentials. What are your thoughts when you hear that? Or I'm sure you've come into work with trainers that have said they're behaviorists, and what are your thoughts on that? Because I feel like everybody says they're a behaviorist, and to be honest, I kind of get upset about it because you've gone through so much to get there, and you're not where you are just saying you're a behaviorist. So what are your thoughts on people, or what should people look out for with that?
Yeah, so the word behaviorist doesn't really mean anything as far as education or schooling. There's going to be 2 types of behaviorists that have a certain level of education. So that's going to be applied animal behaviorist. Those are going to be PhDs. And then there's going to be a veterinary behaviorist, and those are going to be veterinarians. So if you are going to see someone who calls themselves a behaviorist, they have every right to call themselves that, but it doesn't mean anything. If it has applied animal or veterinarian in front of it, then you know that they have that level of schooling.
Okay. I mean, that's good to know.
Yeah, because people think behaviorist means something.
Yes.
It doesn't mean anything. It's like the word specialist. If you're a veterinary specialist, then you're board certified in that body system, orthopedics, dermatology, behavior. But if you're a specialist without veterinary in front, I mean, you could be a plumbing specialist, right? You could be a specialist in anything. So those words don't mean anything without those qualifiers in front.
And I just think it's important for people to know, especially when you're looking. And even if somebody does say they're a trainer and they say you're a behaviorist, like you said, there's no backing behind it. I would still at least ask, like, what does that mean? What kind of schooling did you go through? Because even as we know, dog trainers, there's no mandates, there's no regulation, there's literally nothing. I hope there is someday, but same with that. With anybody that says, for me, a behaviorist or a dog trainer, like dig in more and kind of ask what that means. Now, we were just talking about this. I thought it was only 80, but in the whole, just to give people perspective, in the whole country, right? That number that we were talking about, how many veterinarian behaviorists are there?
Well, so we have 105, but that's all over the world. Now there are other,
it's the world.
Yeah. So there's certifying bodies in Australia and in Europe. So we're not counting those, but
Okay.
ACVB, American College of Veterinary Behaviorists, we have 105. So that includes all of Europe. That includes North America, everything.
Oh, wow. That is like...
It's not very many.
No. And I feel like you've trained a lot of... I mean, how many of them are your students?
Well, 8. Yeah. So I have 8.
What?
Yeah. Yeah.
Wow.
Yeah. My baby doctors. Really proud of them. Yeah.
So with clients, I feel like I know, and I could be wrong, that I know when I need to refer somebody out. In my head, I might think they need medications. I never say that, out loud, although I may say you may need something, but that's not for me to determine. A lot of people that I will say, I think you should see Dr. Radosta, because you really are the only one in the area. By the way, I looked up in a 500-mile radius, 500 miles. There was 1 and 3 of you because they all came up in the different locations. Just to have an idea, like there's not many behaviorists out there. But I lost my train of thought.
So I think where you were headed was when. When do you need me? And where do I fit?
Yes.
Because it's not. So here's the thing. The thing is that I, at 55, have a team. I have a rheumatologist, I have an OBGYN, I have a generalist, I have an allergist. Your dog might need a team. And you're probably used to that as a pet parent because you're thinking, yeah, my dog goes to the dermatologist. Mm-hmm. Yeah, my dog goes to the rehab specialist. Well, behaviorally, your dog might need a team as well. So the team is generally going to consist of a vet behaviorist, a vet, and a dog training professional. If you see me first, I'm going to loop in a dog training professional. So you know that because I refer a lot to you, right? If you go and see a dog training professional first, they may refer you to a vet behaviorist. It doesn't mean you leave the dog training professional. It means they're a part of the team. And your vet is never outside the loop because your vet has to know if I prescribe meds, your vet has to know that, right? Your vet has to know any interactions between other meds that your pet might be on or they might prescribe. So there's this team. Now, if your dog training professional gets upset, if they get their little ego hurt, when you ask about referral, or if your vet does, you're talking to the wrong professional. Because you and I kind of grew up together in this business, and my ego was way bigger 20 years ago. So I know what that feels like to go, you need someone else? It's not all me? No, it's not all me. It's a team of people that I work in. And so if you're talking to your vet and your vet's like, you don't need to see the specialist, you've got a problem. If you're talking to a dog trainer and they say, you don't need a vet behaviorist, you have a problem. It's for you to decide, right?
Yep.
Just like when a client comes to me and I say, you need to work with a dog training professional and here's my list, I give my best recommendation. Mm-hmm. I'm not threatened that they're going to work with a dog training professional because it's just going to improve the outcome, right? Improve the pet's behavior. And then some people will come to me, like you said, when they don't need me. Maybe they knew me from their previous pet and they just want to get this pet checked out. No problem. They come to see me, I do my thing, and then I refer them to you've been on the receiving end of that referral as well. Like, there's nothing wrong with this dog. This is the person you need to see. So there's a team of people, and we should all be talking to each other. And if you're with a professional that doesn't do that, we got a problem.
So saying that, what are your thoughts about, I have a lot of clients that just go to the vet, and they're not all like this. They just go to the veterinarian and get meds from their veterinarian. And I can list on one hand, trazodone, gabapentin, the Prozac, Xanax. That's pretty much the scope of what they do. So what do you say to them? Because I know, and I will say, she's the best. Dr. Radosta is this is what she does. So she knows the research of the new medications coming out, all of that. But some people just think if they get some trazodone or something from their vet that's enough. And I just don't think it is. I mean, what can you say? And again, this isn't all veterinarians. I think most of them will, say they have to talk to you to do something. But what do you say to that for the people that just refuse to, whether it's money, anything else, that they're just going to their veterinarian, which is kind of like a couple of, I found that it's only a couple meds they suggest.
You're right. Veterinarians are they partially practice medicine in the space where they feel comfortable, and they don't want to go outside that space. And if there's 3 drugs in that space, even if that drug may not be completely the best choice for that patient, they're going to choose within that space because their primary concern is always safety, so they go with what they know, right? Which makes sense. Here's the thing, is that it really depends on the person. So I have a family member who recently a human being, who recently went on Zoloft. She went to her primary care practitioner. Another family member, like you become the central sometimes for all the family members. Another one calls me and says, Lisa, you know that this person needs to see a psychiatrist because you know the psychiatrist knows so much more, and the efficacy, how well these meds work, depend on how you prescribe them. And I said, yes, I know, and this other person's comfortable with her GP. So what people have to do is what they're comfortable with, and they have to understand there's no way that a primary care practitioner is going to know what a specialist knows. And maybe your pet will be fine with what your primary care practitioner knows. That's okay. Some dogs are. But maybe that won't be the case. Maybe your dog needs something special. And what people think is, oh my God, but I'll go for the next 6 months. Not always. Sometimes I can say, okay, your dog is on these drugs. How about if we just change the dose or even the way you give them? Like people are giving trazodone 1 hour before the vet. We know that's got to be 3 to 5 hours before the vet for it to really work. So just knowing that about the drug allows me to help the patient without having appointments for, the next 5 years. So if you want to start with your vet, start with your vet. But if your pet is not getting better, don't blame the drugs. Ask for a referral to a specialist, or just go to a specialist. You don't need a referral. And get the information that you need tailored to your dog.
I mean, let's talk about that too, about drugs. I think it's the same with people. Like I have friends that they won't even take Tylenol, and then I have someone like me, if I have old antibiotics, I'm going to save half the bottle to take in case I start getting sick, which I know you're not supposed to do, but I do. I'm like, oh, I have a half a thing of amoxicillin left. So I know that's not good. And then I have, like I said, my friend, they have a headache. They don't even want to take Tylenol. Now, I always try to tell people, listen, just because you're going to a veterinarian behaviorist, just you're going to Dr. Radosta, does not mean she's putting you on meds. And I know there's a lot of like supplements too. I don't know what they are. I mean, I know of them, but she would know. But I feel like some people still do you find, because you would know, that they are still resistant about trying different things? And I always say, your dog's not going to die. I hopefully not. I say that. I say confidently, your dog's not going to die from trying it, but you are going to see if there's improvement. Do you still feel like they get a negative? Do you get negative pushback from that, or what do you usually see, just to kind of ease people's mind about the drugs too?
Yeah, it's really exactly what you said. It depends on that person's personal experience and bias. And there's actually a published study looking at that, interviewing people. And people who go to the veterinary behaviorist who are more likely to accept psychiatric drugs are those who have had good experiences. And the reverse is true. Those whose, let's say their child was put on a medication and that made their child sedated or, loopy, they are less likely to accept those meds. So it's about personal bias. But here's the reality. I don't always prescribe meds. Yesterday I saw a patient who was on Prozac, on fluoxetine, the generic, and on 25 milligrams twice a day, et cetera. And what I did was I said, I'm going to lay out all these options. You're the pet parents. I would like to see how your dog does with my new training plan and just keeping the Prozac the same. But if you don't feel comfortable, here's 3 other drugs we can try. Here's exactly how you can try them if you want. Now, this couple, they said, no, we want to work on training and see if we can change his behavior with a different training plan and keep the meds the same. But some people, let's say that couple had 3 kids under the age of 6. They would have taken the drugs,
yes,
right?
Yes.
And that's where we need to make sure we have a really open mind and we're not judging people. People are going to accept what works for them. When you try psychiatric meds, when your pet goes on psychiatric meds, so that's Prozac, Xanax, gabapentin, Valium, just everything, right? Zoloft. It's very unlikely, like extraordinarily unlikely, that your pet will have a serious side effect that will damage the liver, the kidneys, cause death. Like I've never seen it. I've literally never seen any of that. I've been doing this since I've been boarded since 2006, right? Never seen that happen. Is there a possibility that your pet will have less serious transient side effects? Absolutely. Maybe up to 20 or 30% of patients will. So changes in appetite, changes in activity, maybe changes in kind of their agitation level. Some animals, when they don't have complete control over their faculties, they feel weird and they act out, right? So you might see some of those things, but you just stop giving the medicine and they're gone. They're gone within 8 to 24 hours, gone, right? So the risk is extraordinarily low. I think some people also feel like I'm one of those people that powers through, and I think you and I are those people that raise our kids, insist on being there to drop off, to pick up, who somehow get a workout in every day, who watch what we eat. Like, we're those power people, but animals can't power through. Animals have no voice. They have no agency. You and I have such control over our lives as much as we can. Animals have nothing. And to ask them to power through, I'm just going to be truthful, is heartless. It's heartless.
I think that's so important that you're saying this because they can't power through.
They can't. They have no. Can you imagine? I mean, you and I especially. Could you imagine your husband controls what you eat? When you eat, when you're allowed to leave your house,
no.
When you'll be confined to a room. My chest is hurting.
Yeah.
Like, this would never happen. But this is how animals live. And then we say, but you can't have any medicine to feel better. Right? You can't have anything that's going to help you to feel better. I don't even understand it. I don't.
I try, and I think that's a good way to put that. I'm going to steal that and use that with other people because I think it's true. Like, just try it. Just give yourself. We're live here, so give your dog something to at least try. See if they feel better, and like you said, if they're having any effects, then stop. I have so many people too that was like, oh, I tried it and he just wasn't himself and he just like slept. I'm like, well, maybe you were on the wrong dose.
Yeah, right. Give less. Give it differently. Go back to your vet. And also, too, is there any one of us that doesn't self-medicate? And, okay, I self-medicate with exercise. That's true and that's healthy. But I also like hard liquor. Let's face it. I do. I have to limit it because it's not healthy for me to like one drink a week. But we all self-medicate. We binge on Netflix. How is that healthy? We doom scroll on Instagram or TikTok for hours.
I'm guilty of
like,
TikTok.
But you see what I'm saying?
Yes.
We all self-medicate, and some of the things we medicate with aren't that healthy. But I still have bunches of friends that get on TikTok for 2 hours every night. So you're denying your dog something that will help your dog feel better, but you're self-medicating. This doesn't make sense to me.
Did my husband tell you I'm on TikTok?
No, he didn't.
He comes in and I hide the phone real quick like I'm a little kid. He's like, you're still scrolling? So yes, I totally get that. So let's just jump into, okay, so you think your dog has a problem that you might want to see a veterinary behaviorist. And by the way, you do virtual appointments, right?
Yep.
So if you don't live close, you can do that easily.
Yep.
For me, I'll tell you some of the main things that I see that I'm like go to the behaviorist. Separation anxiety, hate myself. I'm okay if you never send me a separation anxiety. Use that nice list of trainers that you have. I've dealt with it. I think it's long. I think it's tedious. I think it's just, for me, not that I haven't been successful. It's not rewarding for me. It's too slow.
It's slow. It is delayed gratification. However, I don't know how deep we want to get in separation anxiety, but some of the, and I realize this might be controversial, but what difference does it make? It's the truth that some of what's out there now that's being purported as the way to treat separation-related disorders, and if people follow me on Instagram, they already heard this last month. The research shows that it takes forever to work. After 90 repetitions, the dog who could be left the longest was left for 5 minutes. All the other dogs were well below that. So it's not like it was 5, 4.5. It was like 5, and some people were at like 10 seconds.
After 90?
90 departures.
Wow.
Like, give me a dang break. So it can work, but it's being sold as the way. And it's just not true. The other two ways that we treat separation-related disorders, which is the more classical way that you and I probably grew up on, which was teaching a dog to relax in a safe space and then slowly departing and coming back while using food. There's another way, which isn't new, but it's coming to kind of be more generally used, which is using devices like the Go Doggo, which is a AI treat training device for a treat and train, which has now been bought back by Cattle Dog, so it's no longer owned by a shock collar company.
Oh, really?
Yay!
I didn't know that.
Yep.
Because PetSafe had it. I say the names. I don't use anything from them anymore.
No. And so I don't know if Cattle Dog, which is Sophia Yen's company, that Christine Calder is now involved in. But the point is that I'm pretty sure if it's called Treat and Train, it's only available on their website, but definitely don't buy the one that you see on Amazon that's owned by shock collar companies. But anyway, we use those to reinforce the dogs while the people are gone. And the reality is that it works pretty fast, like 2 months as opposed to 6 to 12 months. Yeah. But you have to have a really skilled trainer. I saw a client yesterday and she's working with a trainer, and the trainer might be great in a lot of things, but this obviously wasn't her skill set. You got to have the right trainer for the right problem, you know? So
skip me for separation. But another thing another issue that I would send to you, I love reactivity. Yeah. So I love working with reactive dogs. I can tell when they need medication, if they won't eat. Like you just, their threshold's so small, they're not eating, although I've used space and stuff like that for reward. But reactivity, which I'm sure you see a lot, can be reactive, can be aggressive, can be, everything. That would be one of them. And this is another one that I know you specialize in all of these, but I know you have like a course that you put together for this, is phobias, like noise phobia. Obviously thunder, again, the worst, but like noise, like environmentally sensitive dogs to like noise. I mean, where do you even start with that?
Yeah, that noise phobia is like the root of all evil. It's just like, and everybody down here has it. We live on top of each other in Southeast Florida, and there isn't a winter where we all go inside. Like when I lived in Pennsylvania, I was the only one walking my dog when there was ice and snow everywhere. So dogs get a break. Here, dogs never get a break. And I don't know what it is about South Florida, but our lawns are always being manicured. Every day of the week, there's some person who's cutting the lawn or blowing something or weed whacking. So our dogs never get a break from that. And noise phobia, it is one of the things I'm passionate about, because I think people don't really recognize that a dog who urinates in the house might very well be a dog, you know this, who's afraid to go outside. Mm-hmm. Why are they afraid to go outside? Because everything outside is scary. Why? Because of what they hear. It's a dog I saw yesterday. Again, this is a great example of how you might need a team. So this family has this dog who's petrified of sounds. The dog, when he hears a loud truck, flattens himself. Now, they live in an apartment. Mm-hmm. He's got to be walked. Flattens himself on the ground, and then, he's a big dog, begins to pull them back home. So their trainer told them to keep the dog where it is. Ugh. I knew, right? I knew you would be like, oh my God. So that's not the right thing to do. But the way that I approached it was to say, okay, tell me why you are working. What do you love about this trainer? And they said, you know what? Positive reinforcement trainer, and my dog is so well obedience trained, and I think she does a great job. And I'm like, great. So we're going to keep her for that. She's going to do that for you, right? Like you go to the teacher at school and she teaches your kid math, but maybe you have a Spanish tutor, right? So your dog needs this other trainer too that knows how to do this other thing. So that is just building a team. But noise phobia almost always needs some type of medicine because the dog can't get away, especially these people that don't have a yard. Like, they have to walk their dog. So their dog then gets brutalized and traumatized every day, and there's nothing they can do about it. So by using a medicine to reduce the dog's fear, now the dog can exist, first of all, without re-traumatization, but also the dog can learn, which is what we need it to do in order to get off the medicine, right? So you need the medicine sometimes to get off the medicine.
I think a lot of people don't know their dog is noise like they just think they're scared outside. Like you said, they don't know what it is. So I think going to a professional, a veterinarian behaviorist that knows that, again, I can deal with that. I've done it. It's not my favorite, probably because it takes long. Are you seeing a pattern? Are you seeing a pattern here? I like quick things. Well, I also tell my trainers, like, if something's not working, the teacher's doing it wrong, right? It's not the learner. So if my son is not getting math, the teacher should not keep teaching the dog. Like, as far as like even obedience, I always tell people that's the like easiest part of dogs is the obedience. But if your dog's not getting it or your dog's still jumping, you got to change what you're doing because you're reinforcing that behavior. So
that is crazy because that's exactly what I used to tell my doctors. Whether it's medicine, whether it is treating, diarrhea or aggression or your training plan, if it's not working, you are doing something wrong. Mm-hmm. Because even if your plan is perfect, if the pet parent can't implement it, then it's wrong.
Yes.
You can't stand on your little pedestal and go, but this is the way. Because if the pet parent can't give the medication, there's lots of dogs who act like cats and will not take medicine. Right? They spit the medicine out or they find it under the couch all the time. People tell me this. I found 4 tablets under the couch. I'm like, oh my God. So, it's our job to adapt to people. And it's also our job to be really brutally, empathetically honest. Because the leading on, and I'm going off on a tangent, but this makes me crazy. I had a client the other day I know very well. I love this lady. She's real intense like me, and we get on, and we're like talking about her dog. And she wanted to switch vets. She didn't like that her vet did something. So she went to a new vet, and of course I got the medical record, and so I'm talking to her. I said, did you know that Fido, was muzzled? She goes, what? I'm like, yeah, it says in the medical record, muzzled. And she goes, no. And I said, okay, well, were you with him? She's like, no, they took him in the back to do his anal glands. And I'm like, well, what did they tell you? And she said, they said he did really well. And I said, right now, I'm going to tell you the dirty secret of veterinary medicine. That is the lie that veterinarians and veterinary healthcare team members tell you because they don't want you to hate them. And she goes, but I wouldn't have hated them. And I said, well, lots of people will. And lots of people will grab their dog and leave, right? If the veterinarian's honest and says your dog's really scared, they'll say it must be your problem. So I think we have to be empathetic to people, but I think we also have to be honest with people because that's the only fair thing to do. Like I had a client just the other day who has a dog. She has 2 dogs. You know this scene, Jamie. One is a barking lunatic. Barks all the time at everything. He's very happy barking. He uses his voice. The other one hears that dog use his voice and it freaks her out and she bites him, right? If he would just be quiet, she could live a happy life, but this dog can't live like that. So she's just treating the one dog. And I said to her, this is like going to marriage counseling by yourself. Like this is never going to work. And also, I think it's really important for you to hear, I'm talking to the client now, the only way for me to fix this, if you don't treat the other dog, is to full on sedate this one dog, which I'm not going to do, and you don't want me to do. So medicine is not going to fix this. I want you to hear that up front. It's going to help you. But I think if we're not honest with people, they also leave the office going, I'll just give the pill, which is probably not going to work.
Yeah, people do think that. They think that also on the same thing, yes, try the medicine, but it's also not going to be the quick fix for everything.
Yes.
We are going to talk to Dr. Lisa Radosta more in another segment, but I value your information, your opinion, everything so much. And I want people to know, and by the way, this wonderful woman does talks all over the world, has books out. I can't even keep up with her. She's here, she's there, she's everywhere. So you're a very smart, successful woman, and I appreciate you coming here. But where can people find you? Where can they find you between social media, getting an appointment with you? Where can they do that?
Yeah, so they can go to my website. It's drlisaradosta.com, and there's articles, there's videos. They can find me on YouTube, Instagram, LinkedIn, and Facebook at Dr. Lisa Radosta. Easy.
Okay, perfect. And then from there, appointments, everything.
Yep.
Okay, drlisaradosta.com. Definitely check out her stuff. Her book, too. I love your fear book.
From Fearful to Fear-Free.
Yes.
Yeah.
From Fearful to Fear-Free. Amazing, too. You can get it anywhere. Amazon, would you suggest? Yep. Anywhere. But thank you again for joining Barks to Basics. You can follow us and find us on anywhere where podcasts are on. Also, Spotify, Audible, all of those. Also our social media at Dynamite Dog Training or at Lucky Dog Training Club. But thank you for joining. Thank you so much. And I'm looking forward to talking to you more.
Thank you.
Thank you.